Hi, everyone. It's Kelly from the Hub. As you can see, my close friend who's next door here, this is Carrie Willets. She is the president of WellSpan Health Ephrata Community Hospital, which is a lot of words right there. So we are chatting with Carrie today to talk about the way that our health system here is dealing with all of this stuff. So Carrie, it is so good to hang out with you. How are you?
I'm great. Thank you, Kelly. It's so great to see you. I've
It's
missed
good to see you too. Thank you. So I've got a couple of questions that I've been thinking about. I saw your last interview. I've been paying attention to all the stuff that's going on with WellSpan. They're one of our favorite partners out there simply because you guys are just absolutely great. You talked in your last interview that you are a leader with vision, and I have always felt that since I've met you. So, and also you talked about that you were so impressed that you fixed so many things that were on the list that you wanted to fix in 20 years and that you fixed them in 50 days, which I was like, we all have that list. So my question for you is this: is there one more thing on your list that you want to fix?
Oh, wow. That's a great question. I'll just, as I kind of process, so what have we done in the last 50 days that we have been talking about doing as an organization? So our CEO, Roxana Gapster, has encouraged us to be more agile in our work, to be innovative in our work, to assure that we're highly reliable in all of our outcomes, and to make sure that we are always patient and family centered every day, every time. And so as I reflect on the last 50 days, as you already said, Kelly, we have done a great job being agile as an organization, innovative, patient and family centered, and reliable. And so that one more thing would be to carry that culture forward as we lead as a health system. So one thing we talk about is we've really grown over the last 5 years as a health system, expanding our footprint, and our focus over the next 5 years is to coordinate all those parts and pieces together to assure that our patients, any patient in any community we serve, gets the right care at the right place at the right time. And so it might not be one thing, but it would be, let's keep doing those things. Yeah.
That's awesome. I think that I will say, from a consumer, having telehealth expand and then having the governor support that with some executive orders has been wonderful. How have the rest of the community responded to telehealth?
Oh, that's really great. At first when I heard when we transitioned so very quickly, we had to figure out, how do we keep our community safe while also keeping them healthy, right? Committing. And so our team quickly transitioned to phone visits and then video visits, as you mentioned, for a lot of our routine patient care. Very early on, so just to put it in context, I think, so now WellSpan does 2,000 telehealth visits in a day. Last year, we did 2,000 in 1 year. And so that just tells us, that tells me that our physicians and our advanced practice professionals, so our teams and our patients, were ready for this type of care and interaction. Because and actually, once we stood up, we've really evolved. It used to be, when we first started this, maybe 50 or 60 days ago, there were many, many more phone visits. Now there are many, many more telehealth visits. And so we do look forward to understanding what the final regulation will be on that. So it will help guide how we move forward with our telemedicine services.
That's wonderful. When you look back and look forward, I guess, sort of simultaneously, what lessons have you learned about people? Just all the people. part of your health system, people of the community. What have you learned about all of us out there?
Oh gosh, yeah. I just have to tell you, Kelly, this has been really hard work. It's been really hard, but it has been extremely inspiring
That's awesome.
at the same time. We have the most brave people in our communities and in our workforce particularly. You know, we are all incredibly disrupted by this situation, whether you are a frontline caregiver, whether you're a patient, someone who contracted this virus, or whether you're someone at home. I had a nurse very early on say, you know, I come to work and I'm caring for these patients and I'm learning about them, and I'm trying to make sure that I keep myself safe and my family safe, and then I go home and I'm a teacher because my kids are home. And so what I've learned about people and this community especially is that we're brave, that we're resilient, and something that I'm most proud of this community is that we trust each other. Our staff trusted our leadership. Our community has trusted our health system, and other organizations. We have led in these uncertain times by trusting one another, and that's been incredibly inspiring. You know, I always say that, you know, the foundation of any healthy relationship is trust, right? And we have exhibited trust and extended grace throughout the last 3 months that I hope will carry forward as we carry this community through this.
That's wonderful. Lots of the people that we've been talking to, we've talked about how this has affected them personally. Mm-hmm. And if you don't mind being a little candid with us, how has this been for you?
Oh, wow. Well, as a professional, it's been, you know, I knew I had to change my leadership style. We were leading through a crisis. I had to, and immediately I told myself, you have to be efficient, you have to be effective, and you have to be empathetic, because people are really afraid. And so you have to meet people where they are, and you have to listen to them, because they are, everyone was in such a vulnerable state because we were learning new things every day. The situation was changing, sometimes multiple times a day. And so to just be present with our team members, and to hear them, and to acknowledge if they feel afraid, to acknowledge that it's okay, but we're going to get through this together. Yeah. And the other key message was, we need you. We need everyone on our team, and we are going to get through this together. So that's something that I've learned is, as a leader or as a wife or as a parent or as a member of the community, that each, you know, to really think about what is my role in this, and how do I need to change my behavior in order to fulfill my role in this. And so I knew I had to be efficient and effective in my communications, and I needed to lead with empathy. So as a parent of 2 teenagers,
that's a whole other story. You probably had to use the same leadership skills at work that you did at home, because it's hard.
Yeah, but I have to tell you, I've been so impressed by our school systems, our teachers, the various community groups who have just, it's really been inspiring to me. My kids say they're learning just as much as they would had they been in regular school. They actually do chores without being asked sometimes now. And
don't jinx it. Don't jinx it.
And at some point during this, they've both said, well, this really isn't that bad.
So the resiliency that you have seen in the community also is in your family.
Yeah.
That's
yeah,
wonderful.
Yeah.
That's wonderful.
Yeah.
All right, here's my last question. Are you ready? This is like the big, huge, overarching one.
Uh-oh.
You can say anything you want to this community.
Oh,
What
wow.
do you want to say to them? What do you
Well,
want to tell people?
That's easy. Thank you. Thank you for your support, for your encouragement, and for your collaboration. We have come into work with sidewalk messages written on our sidewalks. We've come to work with messages, huge posters. We have been blessed with people who have sent emails, who have called us randomly. We've had pastors call us to pray over us. We have had food donated, so much food donated to feed our teams. We've been serenaded by our emergency management services, fire trucks, ambulances, police cars, a parade around the hospital. We've been given signs and posters, and we know that many people are affected, have been affected by this, yet the entire community has rallied around our hospital and our care team, and we will never forget that.
It's awesome. That's awesome. Carrie, it's always awesome to hang out with you. It is. It is. I love hanging out. It's fantastic.
Thank you, Kelly.
Be well, friend, okay? I'll see you.
All right. Hey, you be well too. Be safe. Bye-bye.